each of the acupuncture points on the meridians have an energetic aspect to them, right? They have these really interesting names, like Spirit Graveyard is Kidney 23, which is like a very profound name for a point, and it has to do with our astral body and our past lives, for instance. And so it's a way of energetically tapping into the astral body, if people are familiar with that. But with that said, what acupuncture is doing when you put a needle into that point, right? Metal is conductive, so it conducts the flow of qi. So it's moving energy, it's directing energy. And then, based on the different type of manipulation or needle technique that you use, you can strengthen the energy of a point. You can clear energy out. For instance, like clearing heat and inflammation out of the liver for detox and, things like that. And so each of those are energy work because you're tapping into the body's energy and you're directing it, but you're really just directing it to do what it already knows how to do. You're supporting it to do what it already knows how to do. And that's why it's such a beautiful thing, because it's helping the body to heal itself.
Hello and welcome to Nourish. My name is Kasha and I'm a holistic counselor and first-year doctoral student studying acupuncture and traditional Chinese medicine. My mission with this podcast is to share the stories of inspiring humans who have discovered that elusive state of balance between the Western concept of success with more Eastern philosophies of inner knowing and spirituality. Think yin and yang and flow. Now, these two do not need to be separate, but I know firsthand how difficult it can be to reconcile them. As a Silicon Valley burnout SKP myself, teaser, I left the tech world after 10 years of a thriving career in product management. I want to share the stories that I wish I had heard when I was struggling to find that balance and flow myself. My hope is that these interviews can inspire you to rethink your own approach to mental, physical, and spiritual well-being. And if you are struggling, find your way back to authentic alignment. So, sit back, relax, and ground yourself back home, my love. Now let's get started. Hi everyone, welcome back to Nourish. Today I have such a special guest on the podcast. This guest is not only a remarkable practitioner of acupuncture and Chinese medicine in his own right, but he's an incredible teacher. He's actually a former member of the faculty at the American College of Traditional Chinese Medicine, which is where I was going to school before I transferred to Berkeley. And I actually discovered him through the slides that are to this day still being used in class. So you can imagine how incredible those slides were, and also just how amazing it is that his reach and the breadth of knowledge that he has is continuing to be spread. And I'm so honored to have him on the Nourish podcast, to have him share some of that wisdom with us today. So before we dive into what we covered, just a quick intro. Dr. Danny Geren is a licensed acupuncturist and doctor of acupuncture and oriental medicine, as well as a practitioner of intuition medicine, energy healing. He utilizes a wide spectrum of modalities in his healing practices, integrating both ancient wisdom with deeper spiritual and psycho-emotional healing. As a passionate educator, Dr. Geren is currently on faculty at the Academy of Intuition Medicine in Sausalito and previously held positions at the American College of Traditional Chinese Medicine in San Francisco for 6 years. All right, so this episode I would actually say is like a perfect blend of yin and yang, because we definitely dive into the two areas that Dr. Geren specializes in. So we talk about the energetic, emotional, and spiritual conditions that he treats, along with various physical ailments such as acute and chronic pain, sports medicine and orthopedics, neurological conditions, and internal medicine related conditions, and really how they intersect. So, of course, we dive into what is Chinese medicine. We also talk about what is intuition medicine. We dig into the spiritual, more intuitive side of healing, but we also, towards the later half of the episode, get super technical and dive into some of the anatomy and how that actually influences how practitioners treat in Chinese medicine. We talk about acupuncture as energy medicine, the significance of acupuncture points, what do the different points mean, and talk about Chinese medicine as it relates to neurological conditions, orthopedic conditions, sciatica, back pain, everything. So this is a really juicy episode. I'm so excited to bring it to all of you. And now without further ado, let's welcome Dr. Danny Geren to the podcast. So we have a lot to cover, but before we kick it off, I'm going to ask a question that I ask each and every person before we jump into it. And that is, what are 3 words, non-work related, that you would use to describe yourself? Yeah.
So mostly gentle, kind. I try to be very kind to people as much as I can, and a little bit weird.
I love that. Oh, I love that. See, this is why I love that question, because this is obviously our first time actually meeting each other face to face.
Yeah.
And like, I would not have picked up on that just by looking at your website. And you're like a legend over at ACTCM and through Whitney, who's been on the podcast as well. But, those aren't necessarily the words that I would have used to describe you. And that's why I just love that.
Yeah, fantastic. Our internal ideas of how we are is so fascinating.
100%. So let's jump right into it. You are a licensed acupuncturist and doctor of acupuncture and oriental medicine, as well as a practitioner of intuition medicine. So for people who don't know, and we're not going to go too deep into kind of explaining Chinese medicine 101, I'm going to link some podcasts that we already kind of covered some of that in the show notes. But for folks who are tuning in, who have some brief familiarity, can you just share kind of a definition of what is Chinese medicine and what is intuition medicine? Because that I've actually never heard before.
Yeah, to me, Chinese medicine is a system of treating and understanding the body's natural physiology and where those things go wrong. And it's about understanding the nature of illnesses from a very different perspective that's different than Western medicine. And while there's a lot of overlap and there's ways that you can see Western medicine and the Chinese medicine model from that lens, there's something that's incredibly preventative, seeing the big picture before it gets really serious, for instance, and then also the ability to treat things when they are more serious, when people are wanting to, for instance, not just take a pharmaceutical to mask the symptoms and want to like really treat the root cause of what that nature is. And then, so there's so many different tools within Chinese medicine, of course. But that's for me, like a very brief synopsis of what I describe Chinese medicine as. And then intuition medicine is a framework of developing your intuition and seeing things from an energetic point of view and having a lot of different tools of how to work with those things. And it's essentially like shamanism. It's the teacher of the school, the founder of the school, describes it as Western shamanism, where she is very science-based, but also very spiritual and marries the two. So she does a lot of that work where she references, for instance, research studies that are on studying these various aspects of, we could call it shamanism, we can call it's a part of every tradition, right? Taoism, et cetera, et cetera. There's just so much of that in the world's various cultures and religions.
I just want to reflect to you. It's so interesting to hear you say that, Chinese medicine, obviously there's so much memorization. It's so funny because for me, coming from a place where I used to work in the tech world, that field that, one of the many fields that it sounds like you were also kind of nudged to go in that direction. And I already feel like a coming back to home, coming back to balance, just like learning this information. So to have you reflect kind of this next deeper layer within intuition medicine of kind of honing into kind of that spiritual side, it's just so fascinating, just incredibly fascinating.
Beautiful.
So can you kind of give me an idea of how does intuition medicine either differ or complement Chinese medicine? I know you use both in your practice. Do you kind of use them at the same time when working with a patient? I'm so curious, like how you integrate the two.
Yeah, when I was first integrating the practice of intuition medicine into my Chinese medicine practice, it really developed pretty naturally and smoothly. And so essentially part of it, like a typical Chinese medicine intake when a patient comes in, you're talking about what they have going on in their life, what they want to treat. And you ask questions that are from a Chinese medicine point of view. You're trying to figure out that lens of diagnosis from Chinese medicine's perspective. But then if patients are open to it, I don't do it with everybody because some people are not into this. And I sort of feel that out. But a lot of people know me for this kind of work now. So they come already expecting it. Then I go into meditation with them where I look at their energy and I look to see what's going on. Because what's so interesting is that I've seen this just so often is that, yes, we have the Chinese medicine pathologies and imbalances. And at the same time, there's often another layer of it because there's different ways of looking at it. Just in the same way that Chinese medicine has its limitations where you need Western medicine and Western medicine is so important, and vice versa, Western medicine has its limitations and Chinese medicine complements it and sees it from a different perspective. The intuition medicine is another layer to that diagnostic process. And so with that, looking at people's energy, I often will find a lot of different things that wouldn't show up from a Chinese medicine perspective. But with that said, I can still use, there's a lot of emotional, spiritual, energetic acupuncture treatments, for instance, that work on the spiritual and emotional level. And with that extra lens of the intuition medicine diagnosis, I can then hone that treatment. And then once I put the acupuncture needles in that are based on what I'm diagnosing, then I start doing the energy work with it. With intuition medicine, in that training, they teach you so many different types of energies to work with and ways of seeing and diagnosing different energetic systems within the body. And so it becomes this like beautiful complement. And the reason that it stuck so strong in my practice is because the efficacy of it for me was greatly increased. And I was able to help people more quickly, get better results more quickly. And it was just phenomenal. And so it was very inspiring. And so I delved deeper and deeper into the marriage of those two practices together.
Wow. Oh, I'm intrigued. Can you share an example of kind of a diagnostic scenario where these two interplay? I'm so curious about that.
Yeah, maybe we can talk about a patient example. And so one that I was thinking about for our podcast today was had a patient who had been treating for a long time, strictly using Chinese medicine principles. And I was doing something called applied channel theory, which is there's a great book and a great teacher on this. And it involves not just the this point does this point does that from the way it's taught typically, but feeling the meridians and feeling where there's, changes in how it feels and stagnation, et cetera, testing points to see which ones alleviate symptoms. And I was treating this patient for irritable bowel syndrome and she loved them. Like she would get results. She was, every week was like a little bit better, but it was slow. And I kept telling her that I thought it would be good for us to do the intuition medicine check-in and see if there's something deeper going on. And she was resistant for a while. And then eventually she's like, okay, let's do this. And I did it. And I found that essentially she had, without going too in depth into what it was, essentially she had a lot of energy that wasn't hers, that was stuck in her digestive tract, causing all these physical symptoms. And so in one treatment where I did a particular treatment called the internal dragons, it's a set of 7 points. And I did that treatment, did the intuition medicine and energy work with it. And the next time I saw her, she was 80% better just after the one treatment. So it's really, really fun to do these together.
Question for you. When you kind of treat somebody integrating principles of intuition medicine, how important is it that they are also like open and willing, and like, are they kind of a active participant in the healing process, or is it more something that you kind of are providing? I'm curious, like, how important that kind of two-way dynamic is, if that exists or not.
Yeah, for me, it is very important because I want them to, one, give me their permission to work in this way. And two, with that said, then I can also instruct them on things that they can do at the same time. Like often I will have them do visualizations or grounding exercises or, different techniques that I do. So it's so much better when they can be a part of it with me. I don't tend to do a lot of energy work without anyone's permission. Acupuncture itself is energy work. It's just through a different lens. And, if I ever do any energy work that's not without their express consent, it's really just enhancing the treatment that we've already done with the needles. Right. So, like if I do a treatment, for instance, that's called aggressive energy drain, which is great for processing emotions, helping organ physiology, reducing inflammation, reestablishing proper chi flow in the body. The energy work that I do is like very basic, just encouraging those needles to do their job more effectively.
So you said something that I know for folks just tuning in, they will be like, wait, what? And so I want to dive a little bit deeper into that. Can you please explain the concept of like acupuncture and, being kind of means of energy work? What do you mean by that?
So the way that I view it, and I know I'm not alone in this, is, each of the acupuncture points on the meridians have an energetic aspect to them, right? They have these really interesting names, like spirit graveyard is kidney 23, which is like a very profound name for a point, and it has to do with our astral body and our past lives, for instance. And so it's a way of energetically tapping into the astral body, if people are familiar with that. But with that said, what acupuncture is doing when you put a needle into that point, right? Metal is conductive, so it conducts the flow of chi. So it's moving energy, it's directing energy. And then, based on the different type of manipulation or needle technique that you use, you can strengthen the energy of a point. You can clear energy out. For instance, like clearing heat and inflammation out of the liver for detox and, things like that. And so each of those are energy work because you're tapping into the body's energy and you're directing it, but you're really just directing it to do what it already knows how to do. You're supporting it to do what it already knows how to do. And that's why it's such a beautiful thing, because it's helping the body to heal itself.
In talking about the various acupuncture points, can you share a little bit about what are, you gave us kind of a high level overview around like what the needles are doing, but, if anyone's ever seen like a chart of all of the points, there are what, like over 360, right? 362, maybe. I don't know if I'm like remembering that correctly.
And that's just the traditional Chinese medicine viewpoint of the acupuncture points. There's so many other systems of acupuncture that are numerous, like tenfold of that.
Oh, wow.
Basically. I mean, I'm throwing out a number, but there's so many different traditions.
Yeah. See, so like, can you share a little bit with us, what is the significance of these points? Like, just to give people an idea of, are they, as you kind of stimulate them with needles or with some of the other tools, like what exactly is happening? Like, why are certain points chosen over of others? If you can kind of introduce people to kind of that concept.
So the acupuncture points each have different functions. And so there's like an energetic aspect to that where you're directing with the needle. For instance, spleen 6 is a point that's good at building blood. And it's not that it necessarily directly like makes blood stronger or makes more of it, but what it does is it guides the body's ability to make blood, to get more chi to that physiological function to make that happen. So, there's stuff like that. There's points that are really good for headaches if you're dealing with something more physical that are, just for headaches in general, regardless of the cause, like gallbladder 20 is a really good one, large intestine 4. These are 2 points that are really big points that are so commonly used, and they work really great for headaches. And so, there's that aspect of it where they have this different function, and there's various reasons as to why they do that. And essentially, it's a game of observing what these acupuncture points do and then cataloging that so that people have an idea of what it does. And then there's the replicability of using a point for something. But then there's the like idea behind the point and what the point does. Like, why is it that it does what it does? And so, for instance, the large intestine channel, or large intestine 4 specifically, has a connection to the head. And so it treats issues of the head. Or for instance, if people have TMJ, the large intestine channel will go and connect to the jaw via, it's paired with another channel. It has a paired channel with the stomach. And that's a whole nother, theoretical reason as to why those two work together and why they're paired. But for instance, large intestine 4 is also really good for TMJ. And jaw clenching and jaw pain. So there's a lot of stuff like that. And then there's the other layer where there's like an emotional component to it. Is there, there's points that are on the chest and between the rib cages on either side of the sternum. And each of those connect to various aspects of our spirit. And that's why they tend to be really good for emotions. But then on top of that, you can look at the physical connection of all of that. And so those points are right over the heart, and the heart houses our consciousness in Chinese medicine. So treating the heart treats our emotions. They affect the lungs, and the lungs have to do with sadness. And so it helps process sadness, for instance. And so there's all these different layers to how and why the acupuncture points do what they do. And, the best theory I have as to how it was really all figured out was that the ancient Taoist monks were in meditation and they would look at the body and see these energetic centers and trace them and catalog them and started working with them and developed the system and passed it down.
Ooh, that was such a good explanation. By the way, it's so funny because when I speak to a practitioner of Chinese medicine, every single time as a student, like I have things click for me that didn't make sense before. So I just not only want to thank you for, sharing this with all of our listeners, but also for me personally as a student. This is fantastic. So selfish win as well. I love it. So, okay, you hit on something that I find so interesting. And this was actually something that drew me into Chinese medicine, which is the idea of kind of how our emotions influence what shows up in terms of imbalances and like in terms of even disease in the body. Can you share a little bit about how Chinese medicine views emotions and why that is the case according to Chinese medicine?
Yeah, absolutely. It's so fascinating. So there's different categories of like very high level, what causes disease in the body. And what has always been fascinating to me is that the only cause of disease that comes from within us are due to our emotions, or is due to our emotions. And so it's just like fascinating to me that like, you have all this other stuff, right? There's exterior things that come in. There's our diet. There's, our constitution that we get from our parents. But the only thing that we create ourselves that causes disease from inside are our emotions. And it's not to say emotions are bad. It's that wide range of emotions, like emotions that are unprocessed or prolonged exposure to a particular emotion, like prolonged grief or prolonged anger, or something that hits us really strong, like something really traumatic, creating an emotional state. And there's all these like fascinating ways in which the body will try to deal with it. And then if it doesn't deal with it, how does it store it in the body? Where does it store it in the body? And that's part of what I love to do with the intuition medicine part too, is because I can look and see where those emotions are stored and then target it directly in that way. Instead of being like, oh, okay, it's anger. It must be the liver. We got to just treat the liver, So there's like this beautiful interplay of these deeper layers of that. So I think I answered part of your question, but maybe not all of it.
Yeah. So I thought that was such a fantastic explanation. Because it really does provide like an outline of, I think you even said that emotions kind of like settle in your body, right? And you can kind of imagine that like causing like a, like just even like settle it. I don't know. That's such a good word to describe it, right?
Yeah. It's the somatization of the emotions in the body and how it causes imbalances. And, one of the great things of the Chinese medicine viewpoint is that you can look at these imbalances and how these emotions do create organ imbalances and physiological imbalances, whether it's the flow of qi or it's excessive heat and inflammation in an organ. that the emotions do cause all these things, because the emotions will stagnate in the body if they're not processed. And it's there's two different explanations, but I think the one that people will get more easily is like, pre-COVID, essentially, like when you would be in a room with a lot of people, right? It gets hotter in that room. And so in the same way, when those emotions stagnate in a spot, then it creates heat and inflammation in the organ because there's too many people in the room, so to say.
And I mean that, and I've just been able to translate that to actual experiences so many times. I mean, for example, feeling super anxious or nervous, getting butterflies, and then feeling like nauseous, right? Like that is just such a good example of experiencing a little bit of anxiety causing this like physiological experience. And so it's just so easy to see how over time that can cause other kinds of diseases as well, like all different kinds of emotions.
Yeah.
So question for you, and I don't know if you have a fantastic like Chinese medicine perspective on this or intuition medicine perspective, but obviously, we want everybody getting acupuncture, coming to you for intuition medicine or another practitioner, or really doing, I guess, at the end of the day, whatever works for them to release emotions. What are some things that either you do personally or you recommend that your patients do to process these different emotions? Because like, is that something that perhaps we've always known how to do as children and we like unlearned it at some point? But I mean, emotions are kind of an inevitable part of life. So do you have some tangible advice for people as they're like listening to this? Because at this point, I think everyone's paranoid about the diseases that are being caused if they listen to this podcast regularly. So yeah, any advice, please share it with us.
One of the biggest things that I recommend to patients, and I practice this myself, really comes from a marriage of my Buddhist practices that I've done over the years and the intuition medicine, sort of combining those two into one thing that people can do. And so one of the biggest things that is needed in order to process emotions that most of us don't do is really just to hold space for it without trying to change anything. And so much of us, we like want to get through that emotion, and it's just a natural human tendency. I still do it all the time. Like even last night I did, and I had to like catch myself and be like, oh, okay, I'm trying to avoid this. How can I be present with this? And so, the style of meditation that I do is called Vipassana or insight meditation. And it's really good for being present with emotions. But what I love to recommend is that people just start, and this is the intuition medicine part, is like, imagine that you're creating a ball of divine light in your hands, or bright light, just like amazing, clean, clear, bright light. And then you're going to fill it with love for whatever's here, whatever you're experiencing. Just love, whatever it is. You don't have to change anything. It's just pure love. Then you're going to fill it with gratitude, because no matter what it is, it's here to teach you something. And we can be thankful for that. And then lastly, to fill it with acceptance, because it does no good to deny or not accept whatever's happening in this moment, because it's happening. So whatever it is, you send love, gratitude, acceptance. And then with that ball of energy, I bring it into that place wherever you're feeling it in your body. So that's one way that people can visualize it. And what's fascinating is like when people are trying to like just force something to process and to be done with it, they often just not enrage it, but they inflame it, or it gets stronger because we have an aversion to it. And anything that we have an aversion to that we push against just makes more of it. And so the more we can be in that place of equanimity, of balance, of just acceptance, and then fill in that love and gratitude, the more things will start to like naturally unfold without you even trying to do it. And that for me is always the first step, because if you don't do that, then it's all an uphill battle of trying to make things happen.
I love that. I'm going to practice that.
Nice. Yay.
I truly am going to practice that. I love that. It's really tangible. So a question that I've actually been noodling on for a while that I'd love to get your perspective on is, what about movement and moving energy, right? And, let's just say we're dealing with like an overwhelming amount of anger, stress, and we all know that exercise makes you feel good. But are you also, by doing that, and I don't know if there's really a right answer to this, but are you also in a way not processing the emotions because you are physically moving them, but are you not really moving them out? Like, I'd love to get your thoughts on that because I personally, and I can only speak for myself, have this habit of if I'm stressed, I work out. Like, and it really
Mm-hmm.
does help alleviate some of the feelings of stress. But I'm wondering if, is that really no different than like, when I'm stressed, I eat some delicious sugar or chips to kind of alleviate that feeling of anxiety, which also, by the way, was a common habit from my like tech working days. But, that's
Yeah.
neither here nor there.
Yeah, so there's two different things that I'll answer with that because you talked about the like eating when you're stressed. And so the eating when you're stressed doesn't help the stress really. What you're doing is so the in Chinese medicine we have the five different spirits, which we are said to be these five spirits that interact as if we're one in our body. And one of them is the E or the ego or our intellect are different translations of that. And the intellect has its home. Each of them have a home in an organ, and the intellect is essentially in the pancreas. We call it the spleen in Chinese medicine, but that was really a mistranslation, which is such a shame that it was never fixed. But when you talk about the spleen in Chinese medicine, it's really all talking about digestive disorders, and the spleen from a Western anatomical point of view has nothing to do with digestion. So the ego is in the pancreas, and yes, there's part in the brain because it animates the brain. But when we eat, when we're stressed, all we're doing is trying to like give the pancreas something to do so that it can't feed the ego. So you're really just suppressing. So it doesn't actually help it, even though we all do this, right? But when you go for a run or you do exercise, any type of movement like that, what you're doing is all that stress is creating stagnation in the flow of qi in your body. So the qi isn't flowing smoothly. It builds up, and then you feel, for instance, pressure in your chest or in your heart, or your digestion feels off. And all of that is just due to a lack of proper flow of energy in the body. And when you go for a run, you deep breathe, you're moving your muscles, you're pumping the blood, you're pumping the qi. All of that moves the qi and breaks up that stagnation. And so it is helpful, but it's not dealing with the root cause of why you're feeling stressed, right? Because all of it has to do with not only the external circumstances of our world, but more importantly, with how we relate to it.
Oof, I love it. I got that answer because I really have been thinking about this a lot. It's, because I do a lot of journaling. I try to like release the feelings that I'm feeling. But I also move a lot in a way to like process. And I really appreciate that answer.
Yeah. Oh, and one other thing though with that is when you think about movement exercises like qigong, which involves a lot of breath and movement. So yes, you're moving your qi with the movement, but there's a lot of that that's focused on releasing the energy, for instance, within the organs. Like you can release energy with the heart and the lung, and that is a way of energetically releasing the emotions from the way that it is being stored within the body. So that's another great avenue.
So that actually brings me to another question, which is breathing. I know that Chinese medicine talks a lot about the importance of breath. Can you speak to this at all? And like, is all kind of breathing equal? Like, because I know we have to do it, right? Every single day. So could you shed a little bit of light about the importance of breathing from the lens of either and or Chinese medicine and intuition medicine, if it applies to both?
Yeah, the Chinese medicine point of view, which is profound and basic all at the same time, or profound and simple at the same time, is that the lungs are essentially because one of the things that they do is they receive not only energy and fluids, but then they disperse it throughout the body. So it has this movement throughout the body where it keeps everything flowing. And so by doing deep breathing, you're cycling the flow of qi throughout the body. And so there's so much benefit to doing deep breathing. Unfortunately, a lot of us, we all do this. We get stressed, our breathing gets shallow. We don't do that deep breathing. And so we have to train ourselves to do it more and more. And so, some basic ones that I love to do is just like the 5-second inhale, hold for 5 seconds, 5-second exhale, and then start again. Some people like to hold out the breath out for 5 seconds. But even if not doing that and that's uncomfortable, just inhale 5 seconds, exhale 5 seconds. Even that is just super powerful.
Awesome. All right. I'm going to incorporate that too. I have so much homework. I feel like I'm walking away with all these goodies. And so are
Nice.
you if you're listening to this. So I actually want to shift gears because I really want to make sure that I touch on this. I know that you see all different kinds of patients in your practice, but a couple of areas that you focus on are really around sports medicine, pain management, and orthopedic kind of conditions. I see you nodding your head, so I hopefully said that correctly.
Yes, that's
Um,
perfect.
Okay, fantastic. And I find that to be so interesting because when I think about sports medicine, orthopedics, it's like a very anatomical, or at least I guess from the perspective of like Western anatomy, it's like very anatomical in nature, right? Like
Yeah.
you can really explain what happens if there is, let's say, a pinched nerve or whatever. Could you share a little bit about kind of how Chinese medicine views a lot of the conditions? And maybe you can speak to some of the ones that you see in your practice and how you kind of translate both anatomy, which I know is a passion of yours, and Chinese medicine, how you integrate the two to treat these kinds of orthopedic sports medicine conditions.
Yeah, absolutely. I love this topic. And I never, when I was in Chinese medicine school, I didn't think that it would be something I would be as passionate about. But there's something so satisfying about it because you get such immediate feedback of relief a lot of the time. If it's something that is treatable with Chinese medicine, which, acupuncture, for instance, can't treat all pain injuries and all conditions. But um, the Chinese medicine framework has a lot of stuff that, for instance, helps with nerves. For instance, there's these points called the Huatou Jiaji points, which are along the spine and they affect the nerve roots as they leave the spine. And that's fantastic for treating neurological conditions, right? But if you don't understand the neuroanatomy of it, then you're missing out of really knowing which ones you need to do. So, for instance, I'm in the middle of doing a training with this amazing teacher named Pony Chang. I'm like halfway through his whole set of teachings, and his neuroanatomy is just so phenomenal and has changed the way I practice when I'm dealing with neurological conditions. And so having that deeper knowledge, it's not only like, okay, this point treats this nerve root, but understanding on what acupuncture points do these nerves, for instance, bifurcate. And then what's the pathway of those nerves? Oh, okay, you have pain here. Chinese medicine will be like, okay, you work with that meridian, which is helpful, right? You use, like, for instance, there's these category points called the shoestring points that are really good for unblocking flow on the channels and alleviating pain. And yes, that's good. But if you actually know where those nerves are and where to needle them and how to affect them, you have a greater impact of healing. And so then going with this other training that I've done with a teacher named Whitfield Reeves, which is amazing anatomical based acupuncture. And his whole point of view is that, if you understand the anatomy and you know where you can put the needles, that's really what you need to do in order to really heal that area. So if I were to use a point that's like, let's say it's on the large intestine channel, I use that point we mentioned earlier, large intestine 4. Sure, it helps alleviate some pain, it moves things along. But until you get into, for instance, that part of the shoulder where you're having that pain, based on understanding and knowing the anatomy, knowing how to diagnose it, because you can do the physical exam to be like, okay, this right here is a pinched supraspinatus tendon is what's happening. And so we need to know how to needle that. So yes, we can treat the large intestine channel, but knowing how to needle anatomically based, which overlaps to some extent with traditional Chinese medicine acupuncture points, but it doesn't always. And so once you marry those two and you can actually do both of them, the efficacy is tremendously better. And so I love learning this type of stuff. When I treat the neck now, it's not just like gallbladder 20, gallbladder 21, and maybe some other basic points there, but it's like I'm getting into the suboccipital muscles. I'm getting into the sternocleidomastoid. I'm getting into semispinalis capitis, splenius capitis, based on knowing what those muscles do and what their referral patterns are, right? So like if someone has a headache that, shoots to the top of the head, I know I'm dealing with the suboccipitals, or shoots to the eye, or if it's like all on the side of the head, maybe it's the SCM or the sternocleidomastoid. So having that knowledge is just fascinating and so beneficial to having a successful treatment of that.
So, from the Chinese medicine point of view, let's say you're dealing with, and I'll just use myself as an example, which by the way, I wish I had known about this and I had met you when I was on the East Coast dealing with like extreme sciatica, but I'll use that as an example. From like the Western point of view, I think I have a pinched nerve somewhere in my lumbar spine. Like I don't even remember which one, to be honest.
L4 or L5 most likely.
I think it's L4, L5 actually. Yes, probably that one.
That's the understanding of the nerve roots and the neuroanatomy, right? You have to be able to, yeah. But sorry for interrupting. Go ahead.
Yeah, no. So I guess when, like, let's just say that's like the Western condition that I have. Like, how does Chinese medicine look at that? If I come in with like a ton of sciatica pain, I don't know if that's like a common condition that you see, but
Very common.
and very common. Okay. Yeah. From all that sitting, I guess, and other things. But how would you typically look and diagnose that from a Chinese medicine point of view? Because I know that it's not just the lumbar spine, right? Like there are other things kind of included, but now also you're integrating this whole knowledge of the anatomical kind of specifics of the nerve roots and whatnot.
Yeah. When somebody comes into me for sciatica, I'm always differentiating based on a physical exam point of view, and as well as asking if they have imaging, because that'll tell us a lot. But the Chinese medicine point of view is like, okay, which channel is this? And then it'll be like, okay, well, a lot of time it's either urinary bladder or gallbladder channel. And so then you're treating those channels. And yes, that is helpful. And like there's different techniques, like the chain and lock technique, where you're getting at different points along the meridian that are basically at, like, in this case, it would be foot, knee, hip. And then that's a powerful combination that opens up flow throughout the whole meridian. But for me, that's very limited in terms of its efficacy. And so I treat so much of this, but basically what I'll do is I'll differentiate, okay, is this coming from the lumbar spine, which the physical exams for checking for lumbar spine involvement causing pinched sciatic nerve is limited, but it tells you a little bit. If I suspect it, I'm always like, you need to get imaging if you don't have this. We need to be sure. But I can still treat it based on that. Or is this really piriformis syndrome, which is a different thing that affects the sciatic nerve, but it's not true sciatica because it's not coming from the lumbar spine. Piriformis syndrome is much better to have, even though it still causes very similar symptoms, but that's just a muscle tight in the glutes. It's below glute medius, glute minimus, glute maximus. And it's just tight and it's clamping down on the nerve. And so you can do stretches, you can do massage, you can do acupuncture. And this is where knowing your anatomical knowledge is really important, and being able to feel that muscle, because, there's like a point gallbladder 30, which is amazing. It's an important point. I always needle in any sciatica or any piriformis syndrome. But it doesn't actually hit the piriformis muscle. And so being able to feel that, know where, for instance, the trigger points are on that muscle, get the needle, like you use the really big, 90 millimeter length needles, and you really get through all that tissue till you hit that piriformis muscle. And then that will clamp down on it and they'll feel worse for a second. Then the muscle releases and it tends to give lasting relief. So we have this different points of view of like, yes, there's the channel aspect. Again, I don't find that to be as beneficial as understanding, okay, we have nerve roots here, needles in those points that affect the nerve roots, treat along its pathway. Yes, you can treat the piriformis muscle, you can open up the meridian, you can treat now with, for instance, this understanding of neuroanatomy, like, okay, where is this nerve bifurcating, because the sciatic nerve has so many different offshoots of it. Which one of those offshoots is the one that's being affected? Because it's not always all of it. And before I learned this, it was so confusing. Like, talk about, okay, it tends to go down the back of the leg, but then it can go like into all these different directions down the leg. And like there's the tibial nerve and common peroneal nerve, and then its offshoots, and like all this stuff, which is just fascinating. And then you can treat those. And yes, there's a lot of overlap with traditional acupuncture points, but then you need to know how to needle it, like what depth to needle, what angle to needle it. And then I will often hook up electrical stimulation because that really helps nerves to heal. So that's an idea of how I would work with that and diagnose and treat.
So much depth. I think my education will be ever continuing. Truly.
Yes, I know the feeling.
Mm-hmm. So you actually brought up an interesting tool around like electrostimulation. And can you share with us what exactly are you doing when you are kind of including some electrostimulation? And also, when do you choose to use a regular needle versus electrostimulation versus moxa, which even though I've been getting acupuncture for like 10 years, Whitney was the first person who used moxa on me, which was like
Yeah.
absolutely, she was shocked to hear that I'd never
Yeah.
had it,
Yeah. Yeah.
kind of used in a treatment. So I would
Yeah.
love to kind of break the myth that it's just acupuncture points, because there are just so many tools in your toolbox. So yeah, when do you use
Absolutely.
each and the difference?
Yeah, so with electrical stimulation, I mostly use it for physical issues in terms of like orthopedic stuff or sports injuries, pain, etc. Especially even more so, one with nerves, which I mentioned, two with tendons, and three with ligaments, but definitely muscles as well. And so, like for instance, I have someone with knee pain. Patellofemoral disorder is the name of the condition, and I was treating her knee for so long, and then I realized just how tight her quads are, and so needling the femoral nerve, which is the nerve that comes out and then innervates all the quad muscles, and then needling each of the quad muscles was like so much better. She got so much more relief. It's still an uphill battle. She's got a lot to do. But that's one example. Or, for instance, this is another really great example. It's the first time I personally have been able to diagnose this. A long term patient of mine who's been with me since I was a student in the student clinic. He came in because he had a bad fall. His foot fell in between rocks and he like hurt his knee really bad. And so he came in and he doesn't have a lot of money. And I was like, you should get imaging, but let's take a look at this. And I did the orthopedic exam and he had a medial collateral ligament tear. It was my diagnosis of it, not a full tear, but enough so that when you move the knee in and out, the buckling that happens is significant, but it's not completely where it's totally gone, in which case it'll just like completely come out. And so if I just did acupuncture on that, it would have done very little. It would have been helpful, but it would have been very slow. And so when you do electrical stimulation on the needles, and so this is different than a TENS unit, like PTs use, where it's a pad that they put on the skin, that it's beneficial and it's great and it does a lot. But what we're doing is we're connecting electrodes to the acupuncture needles themselves, and then the electricity goes through the needle into along the whole course of that needle. So you're covering a large, deeper anatomical area with it. And so in this case, I needled both along the surface of the ligament and then underneath the ligament and hooked up electrical stimulation through it. When I saw him next week, it was 90% back to normal tightness of that ligament. Within 2 treatments, it was 100% back. He still is in pain and it's still healing, but the tightness of that ligament is back, which has me very hopeful that he won't need surgery. So that's an example of when you'd really like electrical stimulation just makes such a difference. And I used to not be the biggest fan of it. I used to be like, it's okay. It doesn't work great. And then I took classes with Whitfield Reeves and he's like, this is when you do it. And I was like, oh, okay, sure. And then I kind of didn't do it. And then I just started like giving it more of a try. And clinically, the results are just phenomenally better. That's one thing. And so, sorry, did you have a question?
No, I was just going to like be floored for a moment and then also ask you, so how do you differentiate between using like electrostimulation, regular needles, or moxa? Because I know moxa is
Yeah.
also, is that something that you will use for a lot of the conditions that you see?
So I do use a little bit of Moxa. I love how much Moxa Whitney uses. It's amazing. And she inspired me to use more Moxa, which is fantastic. I personally tend to use Moxa when I'm wanting to like tonify chi or bring circulation to an area. I don't do it as much with pain conditions, although I could and it would be great. But I tend to do it like adrenal fatigue or strengthening the pancreas's chi, like strengthen digestive fire, stuff like that, because it is just so beneficial. It is amazing. Um, and there's so much more that moxibustion is used for, and I just don't do it for some reason. And I should. I could incorporate it more than I do.
And just for everybody listening who's like, what is moxa? You got me with the needles. Then there's electrostimulation. I understand that, but what on earth is moxa?
So Moxa is herb called mugwort. And so it tends to be like chopped and then made into like a little stick, and then you light it and then you hold it over an acupuncture point. There's wide ranges. Like I like to just do the indirect moxa where I just hold it over the point and over the needle, which then brings more chi and circulation, and it's said to be putting in chi, putting in energy. So it's a way of like greatly strengthening chi of a particular acupuncture point so that it can do its function, whatever that point's function is. And then there's other forms where people will like make little rice balls and like put like an ointment on the skin and then put the little rice balls on it and then light it. So that's more Japanese style. Because people will put like a big ball of it that they'll clump on the needle itself, on the handle of the needle, and light it, and then that heat transmits into it. I don't do those ones because they're more likely to burn someone. So I just don't take that chance, which it's like the number one malpractice lawsuit in Chinese medicine is burning people. So I tend to err on the side of being cautious or conservative.
That's a good call. I will say, as somebody who has received moxa, that has never happened to me. So if you're getting nervous out there, it's like actually very relaxing and nourishing. So yeah.
And when I say it's the number one thing, it's still very rare, but it does happen. Yeah. So that's why I just do the indirect moxa.
Yeah. Danny, I could literally speak with you all day, but I want to be mindful of your time. So if you could just share with people, like, where can they find you? Is it also more local, or do you do any offerings that are online? I'm going to link this all in the show notes, but just to give people an idea of anything you have coming up, and also how can they connect with you?
Yeah. So right now, in terms of teaching, at least, I'm only teaching at the Academy of Intuition Medicine. So I'm only doing, it is a teaching them of the Chinese medicine energetic systems, but from the lens of how to work with it with the intuition medicine tools from that school. So I'm not teaching Chinese medicine directly at the moment, but I do have the channel, which I know you said you would think, the Demystifying Chinese Medicine, which are excerpts from me teaching a public course. When I used to teach at ACTCM, I taught one that was just for the public, and that was really fun. And so I recorded that and then chopped it up into a bunch of videos for people who are interested in just learning fairly in depth, but more for general public information. In terms of working physically with people, yes, it's the local aspect. I do a lot of distance energy work with patients. And, I have patients who I've treated who are in, all over the United States and New Zealand and Australia and Canada and things like that. And it's super fun. And that's more for the energy work and the intuition medicine aspect of it. And so, by all means, I'm happy to work with people anywhere if they're into that type of stuff. But yeah, I'm in Marin County. If you're local, I would love to see you. Feel free to reach out. The business is Wellspring Acupuncture, and the website is wellspringmarin.com.
For anybody out there who is me 10 years ago suffering from sciatica, do not wait. I really wish I could go back in time and have met you then, but I'm happy that I met you now. And this has been such a pleasure. Thank you so much for gracing us with all of your knowledge, your perspectives. I feel like I've learned so much, and I'm sure the audience feels the same. And it's been such a pleasure. Thank you. Thank you so much for tuning into this episode of Nourish. If you enjoyed this conversation, please leave a positive review. Your rating really helps the podcast grow, and your feedback means the world to me. I publish new episodes twice a month, so hit the subscribe button to be notified. Finally, if you'd like to learn more about the work I do as a holistic counselor or to connect, please head over to my website or my Instagram at Mira_wellness_co. I love speaking with each and every one of you. Thanks again for being a listener, and see you next time.